Prostate cancer does tend to occur in families, and so when we have a patient that has prostate cancer, we suggest that he make sure that his male children start getting evaluated at age 40. When we see people, we'll ask them if there's any history of prostate cancer in their family, such that we know what kind of schedule to put them on and when to start doing their routine prostate exams. It is a very indolent disease. That is, it is a silent killer. You can have prostate cancer and have no idea that you have it. And in fact, it's a much more common occurrence for us to find prostate cancer in people that have no symptoms than the other way around.
Dr. Reyna, who is my physician for urological issues, I go to him for a checkup about once a year. And this particular year, he said, "Henry, I see something here. I felt something here. It's not normal. We ought to have it checked. We ought to have a biopsy done. I don't think it's anything, but there's a little bit of a hard spot that I'm not comfortable with." So I went back for the biopsy in January. He did the biopsy. He called me back the following week and said, "Henry, I'm the most surprised guy in the world, but you have cancer. You have very early, very manageable prostate cancer, and we should immediately meet and talk about the options."
Henry, and ultimately, I think he decided that of the choices that we had discussed, that radiation therapy in the form of IMRT, which is what's called intensity modulated radiation therapy, was going to be best for him.
So I wanted the happy medium between doing something on the one hand, but not doing something invasive with a lot of side effects, something with the least possible damage, and that's where the radiation came in.
In some ways, we were blessed to have Henry here in San Antonio. In a lot of ways, we're blessed to have Henry here in San Antonio. But in the area of prostate cancer, he's been a champion, and he's been a real hero.
He's much more than my urologist. He is effectively my primary doctor, and he's a friend who I trust with just about any intimate question I might have, related medical or otherwise.